When most people get a Stye, they do the wrong thing. They rush to the store and buy some Stye cream. And believe it or not, that is actually a waste of money. I'm going to walk you through why that is wrong and what you really need to do. I'm Dr. James Therian, and I have been an optometrist for over a decade, and I'm approaching about 100,000 patient encounters. And I have seen thousands of patients in clinic that have come in with Styes. Now, in the medical world, we actually call Styes hordeolum. And they come in two flavors, internal and external. External are the ones that typically go away on their own, but internal need a little more help from doctors. So the goal is to keep Styes as external. But in order to do that, we need to know exactly what a Stye is. But here's the thing, I have to clear up an inaccuracy I said earlier. I said a Stye comes in two flavors, but there is actually a third version. This third flavor is a capped gland that is the thing that starts the whole process. You see, what happens is we have oil glands in our upper and lower lid. The oil or meibum is supposed to come out like olive oil, but in some patients, it will actually come out more like butter. This happens when our diet is heavy in omega-6s, which are delicious fried foods, and not the omega-3s, which are like flaxseed. Or when we don't blink as often or as strong as we should. Those things can slow that flow of meibum, which encourages the glands to get a cap on them. And this is where it gets interesting, because when that cap forms, it irritates the cornea or the eyelid. Now that irritation isn't a ton, but just enough that it makes you subconsciously rub the eye. The body wants you to rub it in hopes that when you do that, you will milk that gland slightly and uncap that gland. However, if you have dirty hands, then you just introduced bacteria to the area. Now, if that cap was weak, then the infection might be flushed out by the body pretty quick with a warm compress. These are the ones that fix themselves in a week or so, and why people buy those Stye creams. So let's look at the active ingredient in a Stye cream. This one is the ophthalmologist approved version according to the packaging, and it contains mineral oil. But if I have a plugged oil gland, how would shoving more oil in it help? Here's the secret, it won't. But what happens is the weak plugged gland that would get fixed on its own, well, it gets fixed. Therefore, people think the Stye cream worked and keep buying it, even though it increases the risk of this becoming an internal hordeolum. In other words, stop buying Stye cream because they don't work. Instead, do the warm compress for a couple of days. But if it is still there after a couple of days, or it's painful or getting bigger, then seek medical help. Because if we can get the proper treatment going before it gets too big and nasty, then we can get it cleaned up before it becomes a chalazion and needs surgery. So when I see these in clinic, I prescribe antibiotic, not a topical like you're probably thinking, but it is an oral antibiotic. But why then do so many urgent cares and ER doctors prescribe erythromycin ointment when you go in with a Stye? Here's the thing, they are treating an external hordeolum and not an internal hordeolum. This is what the textbook says to do for an external hordeolum. It says topical antibiotic, hot compress, remove or epilate the associated eyelash. If instead we look up internal hordeolum in the textbook, we now see oral antibiotics as the treatment. In other words, an infection in the eyelid gets two different treatments if they are just a few inches or a few millimeters away from each other. But none of the textbooks suggest mineral oil as a treatment. If you like this type of content, subscribe to the channel where I break down vision and eye issues in plain English.